that forms part of our medical internship training committee. And then yes, just I'm gonna hand over now to my colleague, my co-host, Dr. Kapil, to identify individuals from his side that the first year that have joined the session. But from that reflection from Dr. Langa, we can safely say that indeed we are expanding the program from KZN to the world, starting in Cape Town, Tigerberg. So up we go. Kapil, over to you.
Thanks very much, Ronkelo, and to Langa for on the spot just providing those valuable insights. Really appreciate it. Is there any first year interns, just in the next minute or so, who would like to share their experiences of how internship is going, perhaps? Just in the meanwhile, while we await, just want to really reiterate the statements that we've all made, and Prof. Glover as well, that this is a platform and a kind of program that we'd like to grow beyond just the bounds of UKZN, and really all interns are welcome. It's been quite valuable over the past few years. Perhaps if Dr. Andreas is available, if you'd like to say something briefly. I know Andreas has been quite involved in this program since his first year of internship.
Hi there, thanks very much. I appreciate it. I didn't expect to speak today, but I was just very interested to hear where the program is now currently going. As mentioned, I was involved from my first year internship and joined pretty much in the inception, well, about 6 months post the inception of the committee and of the program. And since then, it's been, we managed to hopefully expand it quite a bit in the 2 years that I was with it, and I really saw fruits coming out very quickly. And I'm so glad that Dr. Singaram and Prof. Glover and everybody who was involved has taken it so much further already. From what I've seen, it's really amazing, and it is such a wonderful opportunity. I think during internship phase, it's vitally important to seek mentors and to look for mentors. But I think in the immediate post internship phase as well, which is obviously where I am now, well, post ComServe phase now, it's something that a lot of people don't really realize unless they have a mentor that's either, a couple years ahead, and then obviously you're looking for mentors that are much further into their careers as well. I think it's good to have a layered mentorship strategy. And I think that what a lot of people haven't realized is internship is as much as there are challenges to it, there is a bit of at least some structure. And it's important to, whilst you're still there and there's a structure that you can lean on, try and lean onto it, because immediately post ComServe is also a different ball game where now nobody is obliged to do anything for you, and nobody is obliged to mentor you at all. And so it's really up to you then to go out and to have established either mentors from prior to that period of time, especially through a mentorship platform and committee such as this one, is of vital importance. I think if you're looking to further your career, it's really important. I think also if you're just looking to keep motivated in your career, I know we've seen it with, both sides of the spectrum. Some are really go-getters and they really want to seek mentorship in order to hit the next level and specialize in this and that. And that's amazing, and that we can help. Well, the program can help with that. But there's a lot of people on the other end of the scale who are just seeking some form of motivation to stay in, through this and just to survive through all of this. And, that's also important. Those people also need to seek mentorship, and it's just as important. And especially one step further after internship and community service, then it's really important. I think a lot of my colleagues have hit a point where they don't know what to do with their lives, and they really haven't had to think about it until now. And so that's, I trust that the committee and the program really does encourage that kind of critical thinking earlier on in your career compared to a lot of my colleagues. And I think that can really, if a person is intentional about it, you can really make great use of this program, and it can really be the start of a lot of good change in the world. And obviously, I want people to seek for mentors, but I want people to then become mentors later down the line. As I mentioned, there's a stagger system in a mentorship, and if somebody is a first-year internship looking to find out a little bit more information, they're more than welcome to contact me or any of my colleagues. And I think that's the way it should be. Just to give that kind of, even if it's just a step or two ahead. I think it's all valuable. But anyway, thank you so much. I really appreciate it. And I'm so glad to see what is happening with the mentorship program. I hope that everyone could hear me clearly. Thank you so much. Bye-bye.
Thanks so much, Andreas. It's quite profound, and really for speaking, spot on. Caught you kind of unaware, but really natural public speaker. And I think it's really valuable what you said about mentorship, that especially I like the concept of, layered mentorship. It doesn't always have to be an illustrious professor, but could be someone just a few years ahead of you. Mentors also in different settings, different spheres. It's not always, someone who's going to be, this major consultant who's really senior with 20, 30 years experience, but it could be someone who's a few years ahead, like a junior MO or someone who just started their RED program, who can just guide you. And it's not necessarily someone who holds your hand and shows you every single thing, but someone who just has an open mind and willing to share their time and advice here and there and give you a bit of guidance and a bit of nudge here and there. So so true and so powerful and so important is mentorship, and really value everyone who's involved in this current mentorship program. I'm just going to hand over to my colleague, Dr. Lonkelo, again to introduce our amazing, phenomenal guest speaker.
Thank you so much, Kapil. I just also recognize some faces here that warm my heart to see. I'm just going to mention a few of them. Those were in my class, so representing class of 2020. I see there's Dr. Nandumiso Carol Mbaga over there. Shout out and big ups to you. I also see that we also got Dr. Stanley Sekule there. Those were in my class. I'm not bragging anyone, please. I'm just booming with pride seeing my classmates and now my colleagues and soon to be co-consultants somewhere, somehow. I also see a phenomenal lady there by the name Tivana Chalan. It's good to see your faces. It's good to see you all. Without further ado, let me then, we'll go to the next part of our program. I also see Ishani. We will then go to the next part of our program. So the next part of our program will be the session that we are all here for. We have a talk on the tips and tricks on how to prepare for registrar interviews and specializing. So we have a guest that's going to be presenting on that talk, is Professor Dean Copeland. Professor Dean Copeland is an active academic, is a clinician, is a researcher, is a teacher, and a leader in the fields of anesthesiology and critical care medicine. He is currently active associate professor in the discipline of anesthesiology and critical care. He is also the immediate past president of Critical Care Society of Southern Africa, president of the College of Anesthetists of South Africa. Additionally, he currently fulfills numerous other international, national, and provincial leadership and management roles, including as a member of the International Intensive and Critical Care Medicine Committee. He's also a member of the KZN Registrar Steering Committee. His current research interest in decision-making in ICU and medical education and training in anesthesiology and critical care. In his spare time, you will mostly likely find him hacking away in the golf course. Professor Dean Copeland is a proudly South African UK as an alumni with a long history of association and service both in the institution and his country. Ladies and gentlemen, take out your pens, take out your diaries, and let us enjoy and capacitate ourselves with such a well of experience. Prof. Copeland, over to you, Prof.
Thank you very much, Dr. Mkhize. I just want to make sure you are seeing my presentation on a full presentation mode.
Yes, we are seeing, Prof.
Great, and you can hear me.
Yes, we can hear clearly, Prof.
Yeah.
Great, thanks a lot. All right, good evening, everybody. It's great to be here. I was on a very early meeting as part of this mentorship a while back, and it's great to know that this program is going from strength to strength, and big kudos to everybody who's been instrumental in keeping it going. I think I gave Dr. Mkhize a bit of a stroke earlier today when he called me and I said I couldn't remember whether the meeting was today or tomorrow, and he thought I was unprepared for it. Anyway, I've taken the liberty of broadening the talk from just focusing on the interview to maybe describing a little bit more of the pathway to specialization. The interview is just one small spot on that pathway, and I want to give you some background that actually then gives you context as to how you should think about it. So amongst the various hats I wear, it's these three hats that inform my insights that I will share with you today. As chair of the EdCom of the Colleges of Medicine, as HOD for anesthesia, and as part of the Registrar Steering Committee, I've had the fortune of developing some insights into how these processes work towards specialization. So this path to specialization can be an easy path, it can be a steep path, it can be a difficult path, it can be a tortuous path. And to a large extent, it depends on what we do as individuals to carve out this path and navigate it as best we can. Now, of course, many of us will feel like we're having to scale Everest if we're having to get through to reach the point of a specialty or a subspecialty for that matter. And is it like that? Well, maybe it is, and I'm sure you've all put this into context of what it means and the heights that you have to scale, or one has to scale to reach the level of a specialist or subspecialist. And I just want to throw a disclaimer that I'm in no way discouraging you by presenting this mountain that often people have to climb. But if we look at it in a temporal form, the undergraduate program varies from 5 to 6 years across the country. You do 2 years of internship and a year of comm service, and you're already 9 years in the game, which is a lot, right? It's a long time to be in a game already. If you compare that to your colleagues who finished matric with you, and they've done a 4-year degree, they've been working for 5 years already and have purchased their house and their car. So we sit in a very different space in medicine in that kind of way. And then you go and work for a year or two as a medical officer to cut your teeth in the discipline. You apply for a registrar job. You take on this registrarship, and it varies for 4 to 5 years, depending on the specialty that you choose. And then you have to work for another 2 years as a specialist before you embark on subspecialist training, which could be anything from 2 to 4 years. So if you look at that in total, this range to reach this level of a specialist or subspecialist can go anything from 15 to 22 years. And that's a really long time. So one has to be really invested in this process if you want to make a success of it. A nice quote: "It isn't the mountains ahead to climb that wear you out, it's the pebble in your shoe." And if you haven't heard that one, interestingly, it comes from somebody who you might not have guessed. It comes from Muhammad Ali, who said that. And it's something to bear in mind, that we shouldn't just look at the Everest and say, forget it, but we should sort out the little things that plague us along the way, and it will allow us to get to scale this height quite easily. So I just want to put this into perspective. I think it's very useful, and many of you probably have come across this Dunning-Kruger effect, and it's really a graph of your confidence versus your knowledge in the field. And you'll see different iterations of this, but this is something like this. When you start off in a field, you don't know much about it, your confidence is low, and you're really wondering, what are you doing there? But within a very short space of time, you think you're the hot shot. You know everything in the field, and you're the don. And as you gain more knowledge in a field, you start realizing that there's more to this than I thought, and to a point where you start despairing somewhat. And you feel like you're never going to get to understand all this. And it takes a lot more effort and knowledge and experience before things really start making sense to you. And only then can you start climbing up again and building your confidence. But even then, you never quite reach the confidence, because you know enough about the subject to not be overconfident and know that it's truly complicated. Somewhat colloquially, this initial peak is called the peak of Mount Stupid, because I think all of us, when we embark on something and just get the hang of it, think we the experts. And only when you learn more do you enter the valley of despair that then starts putting things into perspective for you. And only after that can you start climbing the slope of enlightenment. Now, this holds true for everything you've done. It held true for when you were a medical student. It'll hold true in your internship, comm service, medical officer. It holds true when you specialize and when you do a subspecialist level as well. So throughout your career, you will go through this. Understanding it and maturing with it allows it to be that much easier. So why should we specialize? Is it something we should be doing in a country like ours? Is there even a need for us to talk about specialties? Well, yes, there is. I think an expert is one who knows more and more about less and less. And if I can somewhat tongue-in-cheek throw in there that hopefully not until they know absolutely everything about nothing, because that's not where we want to go. So the tendency to focus inward and inward and inward to the nth degree often can be a problem. But experts do add value. They do make a difference. And I'll give you one example where it is so. So this is some data from the African Surgical Outcomes study that our group looked at. And this just one part of it, looking at the surgical workforce, the specialist surgical workforce and the density. So this graph shows you the maternal survival versus the workforce density. And this is specifically related to obstetric and surgical pathologies. For it to make a difference, the green part that you're seeing is a curve, you need about 20 to 40 specialists per 100,000. On average, Africa is sitting less than 1. South Africa, if we look at anesthesia, surgical, and obstetric specialists, is sitting at about 10, which is well below the norm. So we're saying that specialists make a difference, but they're in short supply. And if you look at medical specialists in South Africa, it's something you all know that we have this maldistribution. The blue on the schematic on the left indicates those in private, and you can see those long lines, the gold in public sector and the red in both. And if we look at this overall, there's only 7 specialists per 100,000, 69 per 100,000 in private, and the national average is in the order of about 16.5. And compared to other countries, we're way behind the 8 ball. The projections say that we will double by 2040, but we're still going to be way short. So we're saying that specialists are important, and they're in short supply. So there's a need for specialists, knowing full well that not everybody's going to become specialists, and not everybody should become specialists, because any kind of healthy, appropriate system, successful healthcare system, needs the right balance of the two. The generalists and the specialists are both fundamental to ensuring that the system works. So we have to think about it in that context. So if you decide you're going to embark on the specialty pathway, how did you choose a specialty? Because there's so much to choose from. Days are gone when you just were limited to a handful. Now there's new specialties developing. And this was a very interesting one that I'm sure many of you have seen, about how you go about choosing a specialty. And it was devised by a medical student, as I suspect, when he was sitting at a rather boring lecture. But you take me as a medical student, and if I was sane and my attitude, where it didn't matter I was nice or mean, and my patient preference was for them to be asleep, I ended up in anesthesia. It's somewhat tongue-in-cheek, I know, but it's a useful way to think about this vast array of specialties that we have from which to choose. We looked at this more closely with one of our registrars who looked at the perceptions of the final year medical students, and these were the specialties that were the most popular. They're listed here. But perhaps more importantly, I want you to pay attention to this one on the right, which are the reasons for the choice of specialties, because I'm sure many of you would have been going through these already as a medical student, even before that, as an intern now, and in your subsequent parts of your career. Your undergraduate rotation in med school makes a difference to what you end up choosing, what kind of time for your family it gives you, how intellectually stimulating or challenging it is. The patient contact, the balance of patient contact might influence what you want to do. Money makes a difference, and earning potential of subspecialties becomes a key part. The diversity of the clinical spectrum might be a factor for many people who don't want to just focus on one narrow aspect, but you'll do a broader discipline such as internal medicine or perioperative medicine, as anesthesia is. We're talking about mentorship and role models, and this becomes key. There's no question that exposure to an impressive mentor certainly colors your choice of what you want to do. And again, a whole host of other things you'll consider, from the prestige of the specialty, what's the work-life balance the specialty will give me, what's the research potential. Some people might say, how marketable does this make me to the overseas market? What does my family think? Does it give me teaching opportunities? And these are the kinds of factors that allow one to choose where you're going to end up. But I just want a word of warning here. So even if you have chosen already while you were in medical school, this was a nice little study from an American group that then looked at people who had chosen as medical students and where they actually ended up. And of all the specialties, orthopedic surgery was the one where most people who decided as medical students actually ended up there. But even then, when you look at this and you look at the blue part of this pie chart on the top left-hand circle, just over 50% of people that thought they were going to do orthopedic surgery ended up doing orthopedic surgery. So your choices get colored as you progress in where you want to end up. Opportunity becomes a factor, your changing interests become a factor, your experience in a specific discipline changes the way you view it. So really the advice in this regard is you have to experience it first. I think many people think when they're in high school, I want to be this hotshot neurosurgery surgeon without knowing exactly what goes into it. So you have to experience this. And this is the part of your career you're embarking on now in your internship in comm service and medical officer space, where you play around in different fields while you decide what is going to be the area that's going to be the definitive path that you follow. And the second piece of advice linked to that is you mustn't rush it. We all have this time pressure that I need to get done with comm service, I need to get into reg program, I need to finish that and move on. The truth is that, and I suppose you can only say that much later when you look at it retrospectively, is that 6 months or a year delaying you into the process of choosing correctly doesn't make a big difference in the grand scheme of things. And it's very useful to be considered down the pathway you're going to follow than rushing it. A specialist list. It sounded very funny when I said it like that. It's the first time I said a specialist list. Almost sounded like I've got a lisp. But these are the specialist areas that are available for one in South Africa. They include new specialties like sports and exercise medicine is a new college and a new fellowship that is being offered. But not all of these are offered across all sites in South Africa. All of these have fellowships offered by the College of Medicine, so there's an exit specialty exam at the end, and all of them are registrable with the HPCSA. So your choices are quite varied in terms of what you have to choose from. The next element I want to focus on are the attributes of a specialist. What is it that people on the selection side are looking at that will get people into a program and make them into the specialists we want to make them? Now, you're familiar with these attributes because it's really a balance of more than just the medical expert, which certainly, and Prof. Glover indicated in the chat that we were medical students together. Certainly when we qualified in 1989, the focus was on being a medical expert. The others were really secondary, if existent at all. And the CanMed scheme has really pushed people into thinking about broader roles of professionals, communicators, collaborators, a whole series of other roles that allow one to function truly as a specialist. And that's been adapted in the AfriMed's setup, which all of you are familiar with, coming through the undergraduate program, focusing on that. And we've looked at it at a specialist level using the anesthesia model, where we've added two elements which are key. The one is context awareness, because the context in which specialists work is fundamental to how they work and how they work effectively. And the other is right at the heart of being a medical expert, is this humaneness part. Because first and foremost, we're human. And that fundamental thing is a key part of how we should interact with our fellow colleagues and our patients, because really that's why we are where we are. So there's some stuff you should know. You must know the rules. You're not going to play rugby or cricket if you don't know the rules. You must know the rules. And it astounds me sometimes that registrars well into the program who are about to go for their exams are not familiar with the regulations and rules that are on the college website for what it takes to pass that exam. So you have to familiarize yourself with that. You have to talk to people. The information is available. You need to know what goes into this if I want to become the specialist cardiothoracic surgeon. What does it mean that I need to do in that time? How many exams are there? What do they really test in those exams? And that information is available. It's increasingly available in the discipline and within the college. The other thing that you need to know is how you fit into this whole thing. Because the tendency when there are multiple role players is for you to be pulled into different directions. So the HPCSA, of course, is the regulatory oversight body of the profession in the country. The college is the examining body that the HPCSA have mandated to run the assessments for them so one can register as a specialist with the HPCSA. The Department of Health pays our salaries and creates the clinical platform where we work and train. And the university is the training platform that the custodians of the training program, the curriculum, and how it's delivered. Now, each of these competing role players might pull you, who is actually sitting at the middle of this, in a different direction. When it works, and it works well, they work in harmony to help you climb up this ascent as easily as possible. But you often find conflicting pulls in different directions about that. And one just needs to be aware of where you're sitting within the space that's the multiple role player. And then the most important part is that these role players don't exist in isolation. They exist within a society. And we do what we do as part of this broader society. So I keep reminding you that we need to come back to reflect on how what we're doing is, yes, maybe benefiting us, benefiting the discipline, but on a broader scale, improving the society in which we live and thrive. I'm going to take you to the end and then bring you back because it puts into perspective of what you need to be able to do. So this is the form that you complete when you've done everything. You complete this form, you get the signatures, and off it goes to the HPCSA. They have a meeting, and then they say, yes, Dr. Mkhize can now be a specialist cardiothoracic surgeon. There's his letter. We're adding him to the register, and off he goes. But there's a lot that needs to go into that before that happens. So let's look at some of those in more detail. Essentially, there's 4 groups of things. There's 4 signatures and stamps you need to get there. The academic department, the research project, the hospital clinical platform, and the university. And each one of them needs a different thing. From an academic department point of view, there are academic outputs, endpoints that you have to reach. And those must be achieved as part of the outcomes that we're driving in the training platform. Of course, you need to complete exams, and that's a core component of what you need to do. And various specialties have different numbers of exams. Some of them have 2, some of them have 3, and it varies in that kind of way, and you have to be familiar with that and have to get through those. Increasingly, the overimportance that's placed on an exam at the end, an exit exam, is being changed. So it's becoming more a capstone exam, and the development of workplace-based assessments is a key part of that. You have to complete a research project to allow you to register, and here you have to have done a methodology course, and you have to have completed your project either as a dissertation, modified dissertation, or a publication. The institution in which you work has to be an accredited institution, and you have to complete the requisite time. Most specialties require 48 months, and depending on the specialty in which you'll end up, the rotations through different sites will vary based on the modules that are being offered at the respective places. And the last component of the university is that you have to complete university requirements. You have to have been registered as a student. You have to have met the university requirements in terms of the various outputs that you have needed to achieve, including your GPs and stuff like that. Only then can you register. And this is now all at the end. And it's the 4 years and the time before that you spend getting you to that point. This is not a 4-year program. It actually is much longer than that. I always tell my trainees, don't stress about this exam. You've been preparing it for your whole medical career, not just the last year. Everything you've learned since you started medical school has been this build to getting you to this point. This is a site you need to be familiar with. This is our Department of Health site, and if you look at the Careers Opportunity tab, you'll see the Registrar program reflected there. And if you click on that, you'll get information related to the Registrar program. So please familiarize yourself with that. That's where information comes out. That's where the adverts for Registrar posts come out, and you need to be aware of that and react timelessly. Just so you understand how it works, there's a committee that sits at the provincial level called the Registrar Steering Committee. It's made up of Department of Health members and university members, and together that committee acts as the custodian of the Registrar program for the province. So they look at how the program operates, what are the outputs of the program, what regulations do we set in place of how we can make the program run more efficiently. And I put an email address down there, which is also on the website. Mrs. Erasmus, who manages this program, is very helpful in clarifying doubts you have about the actual details of the process. So, you have now decided that you want to specialize, you've chosen your specialty, and you've done your initial requirements as part of that. You've garnered some experience in the field, and now you see this advert that comes out, and you decide you want to throw your name into the hat. So there's some things you need to do in this regard. The advert comes out twice a year. There's an advert that comes out in February, March, and that's for the July intake, which is a much smaller intake. And there's an advert that comes out in August, September, and that's for the January intake. That's usually a bigger intake. There's bigger change over happening in January. But you need to look at the advert properly, please. We look at the quality of applications that come through. And yes, not everybody's application is like that, but a large number of the applications are rather poor in the way they represent the information that they should. So please look at those adverts in detail, get an understanding of what directions are asked. They're asking you for a CV, so you're going to structure that appropriately. I'll tell you about that now. They ask you for certified copies of documents. Make sure you send that. Look at which disciplines are being advertised, where they're being advertised, and what the minimum requirements are, and whether you meet those or not. We still get people applying for these posts. We get non-doctors applying for the post, and it then means they not even read the minimum requirements of the posts. So please make sure you understand what is being asked for and what is there. Take note also of some of the special requirements that might exist for some of the disciplines. Remember, the training program varies from discipline to discipline. Broadly, they're similar, but there are specific requirements that might exist in some disciplines. So some might ask for the diploma, some might ask for the experience, others might ask for varying qualifications within that. Note what the key skills are, the key performance areas, and importantly note the specific directions that you have to complete to make sure your application is in. Note the closing date too, because we often get applicants putting applications past the closing date, and that often ends up becoming a problem. There is a special checklist that we've created which should also give you some sort of direction about things that we're asking for specifically. And these are, if you've been on the program before, we need to know that because we want to be fair and give everybody a chance. You need to have had 12 months of experience as a medical officer post-com service. And that's the time when you might get the exposure in the discipline to which you want to apply, or it might be in another discipline. If it's in another discipline, then you will subsequently have to do some time in the discipline for which you're applying, because most disciplines will want you to have at least 6 months experience there. It also asks whether you've done any exams in the discipline and whether you've made progress in the form of a diploma or primary, and it asks you some other questions about your citizenship and the like. So be deliberate about how you complete this and ensure that you've got all the information you need available for people that are looking at it. The curriculum vitae astounds us when we look at applications. This is a first impression. Make it true and verifiable, clear and informative. Lay it out properly. When you're writing your experience, make sure every time period is covered, because we will look at that and we wonder what happened to this person for 1 year. Where were they? Express that. If you took time out from medicine, indicate that. So it gives us a complete picture of what you did. Yes, it needs to be detailed, but not overly so now. So we don't expect you to write down the art award you won in grade 3. That doesn't matter much. But certainly if you were head prefect in matric year, that's useful as a leadership potential you might well have. So I think let's look at that in a way that represents what it needs to for this. Note the advantages in the scoring criteria. You have to give us a list of independent referees. I mentioned certified copies. Always write a covering letter. In that covering letter, give us a sense of why you're applying and that you meet the minimum criteria. So a covering letter is a key part of that application. We've been very sympathetic over the years of accepting incomplete applications and asking people to subsequently come with documents and the like. But I can promise you, as this process is becoming increasingly competitive, the tolerance for incomplete applications is going to be a problem. So make sure you put in a complete application with what is required. A panel that's established will then go through all the applicants and shortlist applicants that meet the minimum criteria. And these are usually your MBCHB, current registration for independent practice with HBCSA, 12 months post-com service, driver's license, and then some specific department requirements. Depending on the number of posts and the number of applicants, if we've got a large number of applicants for very few posts, the HR prescripts allow that number to be trimmed down. And the prescripts are very clearly defined in that. So that's how you'll end up with a short list of people. And then comes the very much dreaded interview. I think people are often scared about this. It feels like you're sitting in a final oral exam of some sorts. Many people say it's actually worse than that because you don't know what's getting. At least you could learn, study for your final viva. So we don't want you to be this guy who's going to perform the song and dance and try to impress the interview panel. Really, this is a professional setup. But you need to prepare. Think about what they're likely to ask you. There's only a limited number of areas that panels explore. Practice that with somebody. Record it on your phone. Have a look at how you're saying what you're saying. That's the way to understand how you're coming across. Speak to people. Speak to others who have been through it. They'll give you insights that you are really, really rich. Check the departmental websites. If they've got handbooks, they've got information, show that you've read it. It gives the interviewers the impression that you have taken this seriously. You've taken the pain to learn about what is happening there. Be professional. That's a standard. Your punctuality, your dress, your conduct, your attitude, your cell phones need to be off, all smiling and being engaging with the interviewers is a key part. But remember, it's just a snapshot. We're only catching you for that short part. We're not seeing the whole picture of you. So you're having a chance to let us learn about you. So use that opportunity for that to happen. Enhance that by answering the questions appropriately and coming with a portfolio. I'll tell you about that just now. And at the end, make a point of making a list of questions you want to ask, at least one or two, not just for the sake of asking questions, but to really clarify. And the interview panel then clearly understands that this person has thought about the issues and is clarifying something that's bothering them. That shows that you're actually understanding what needs to be done. Don't fret about the unfairness of the panels. There are strict processes by which balanced, fair panels are constituted. And importantly, you need to understand, as many people don't like to be under the spotlight and have this engagement, that you have to pass the interview, yes, but it's not the only thing that counts according to how people are ranked. It used to be, but now we look at a broad series of items that determine how people get ranked. And these are some of the things that then go into a selection criteria rubric that is applied. We look at whether you have additional qualifications, especially in the field. We look at work experience, and if you've got rural work experience, it definitely gives you extra points. If you've shown some sort of inkling to embark on your research project already, you'll get points. If you've got leadership roles, meritorious achievements, you'll get points. We get points for independent referees reports that are good. And then the interview score counts as part of this overall points. So it's not just the be-all and end-all. What can I do to prepare myself? Well, there are a few things we can do. Now, success is where preparation and opportunity meet, and failure is when they meet, but they just can't stand each other. And in that way, everything collapses. So work towards the decision. I don't think everybody is in a space where we can say confidently, we've chosen this is what we want to do. Nothing's cast in stone. You'll embark on that. Ensure you have the support, consider logistics, and start on the general criteria. Develop a portfolio, start on your work experience, start getting some research exposure, and embark on supplementary courses like the ESMOE and Airway and the like. And then only start working on the specific requirements of getting experience within anesthesia, for example, and embarking on the diploma. This is a very useful chart. You should keep something like this starting next year. It gives you an overall idea of your academic research, rotations, clinical meetings and conferences, and personal. It gives you a global snapshot that we constantly review as part of your development. One of the things you can embark on is starting on the research pathway. Even if it's not something that interests you, you know you have to do it. It will take you time. You can register for the methodology course in advance for non-degree purposes. You can do good GCP courses online, and you can start developing that so when you get onto the program, you hit the ground running. I'm almost done. I want you to understand the importance of keeping a portfolio of learning. So I'm not sure how many of you already are doing that. This is an essential. It's compulsory for registrars to keep a portfolio. If you haven't started, please start today. It's a performance portfolio which captures everything that you do in medicine. It will include your log book, but it will include all the exposure to any other academic situations to which you expose yourself. There's one example. It's not the only one. Logbox is free for medical professionals, so you can sign up for this and keep it. Many people use this as part of the college and departments. It's a useful way to keep information. Whatever you decide to do, having a portfolio is going to help you. So registrarship, the best time of your life, you might think I'm talking nonsense. And again, you can only glean that if you look through the retrospectoscope after many years of having done that. And probably when I see you in 4, 5, 6 years' time after you've finished your specialty, we'll ask you how it was. I'm going to leave it there and hopefully take any questions anybody might have in terms of what I've said. Thank you very much.
Thank you so much, Prof. Wow, what an insightful and an inspiring presentation. So I think without further ado, I see that we are 4 minutes out of time. I'm gonna allow 2 questions from the panel. If there be 2 questions, then we'll take it from there. Can you get anyone who has a question? You can just raise your hand. from the audience, and then Prof will attend to it. I see Dr. Bobo Mtumbeni, you are up.
Hi, guys. Thank you so much. Prof, that was such a wonderful talk, so insightful. I'm currently doing my ComServe year in rural Free State, so I was feeling quite disheartened at possibly having to give up on my specializing dreams, but I'm feeling reinvigorated, so thank you. I just wanted to ask, with regards to the portfolio of learning, does it have to be almost honed into the specialty of choice, or can it be more broad and just in terms of general procedures and experience?
Yeah, no, thank you. Thank you very much. It's glad. I like the enthusiasm in your voice that I'm hearing. So you should never give up on specialization because you're sitting in a rural part of the world.
Thank you, Prof.
Increasingly, what has happened is that the virtual online resources are fantastic. The college is developing that. Many departments have done that. Tap into that, and you'll find you'll be able to get a lot of that kind of stuff. In terms of the
awesome.
portfolio itself, when you start keeping a portfolio now as an intern or as a comm service next year or as a medical officer the following year, you'll keep whatever you're doing. It doesn't have to be discipline specific. If you're doing your medical officer time in pediatrics, you keep a log of all your pediatric stuff that you've done. When you go into surgery the next year, then you'll start keeping surgery stuff. You need to keep a log of all the stuff you're doing. So it doesn't have to be discipline specific.
Awesome. Thank you, Prof.
Thank you. I also see Dr. Andreas, your hand is up. You're up, sir.
Really appreciate the guidance. It's vitally important at the moment, and I think it's where a lot of us are, and I think me particularly, with the idea and hopefully wanting to specialize. I wanted to ask, Prof, in terms of it's very competitive to get into these medical officer posts, particularly for the post-ComServe graduates and so on. At this point in time, if one is to weigh up holding out to try and get a post in your speciality of choice, or going rural, because I see both count on that rubric. Would a person advise going rural until you can get a specialization specific post, or is a post in another speciality, for instance, a different type of surgical speciality, more worth it than pursuing the rural part of the rubric, if you're not currently placed in a rural environment, if that makes sense?
No, it makes sense, and yeah, that's a good question. It's a quandary that I think a lot of people find themselves in. So the issue is that every learning opportunity you get enhances you as a person, as a doctor. They bring different things to the party. If you've never done rural time before, then doing some rural time would be fantastic. It brings a different perspective into how you manage patients, no question about that. If you have done some rural time, then you might argue that, okay, I want to do anesthesia, I can't get a medical officer post, let me go do some time in emergency medicine, because the skills I learn in emergency medicine might be transferable or might be useful in this discipline. Or like you mentioned, cross-cutting surgical disciplines, where the surgical skills you learn will hold you in good stead anyway. So yeah, medical officer posts are a challenge, especially in the highly sought after, more competitive central type settings. But as one moves outside, they become that much more easily available. As we go through this process, I think certainly in our province, the weighting that we're starting to give rural is increasing. And I think people are understanding that if I do my rural time, it's going to put me ahead of the pack. So let me go and do my rural time in that regard. So I'm not saying do one or the other. It depends on where you are. If you haven't done rural, do some rural. If you have done rural, maybe an allied discipline with some sort of exposure might hold you in good standing. I hope that answered your question, Andreas.
Thank you very much, Prof. I appreciate that.
Talk to people. I think you'll find when you chat with people, especially from the discipline or related disciplines, you'll find that they'll tell you, they'll advise you. That post there might actually be useful because there's good stuff that's happening in that space there. So that might be useful for you. There's an understanding of the platform that people have that will enhance you and will give you a better understanding of that, really.
Thank you so much, Prof. Just before we close the session, I just want to give a heads up to all the aspiring dermatologists. There's a through pass that Prof. Rosa just put on the chat there. She says, and I quote, in derm, we always have a preference for rural doctors. So to all the dermatologists, don't say we didn't give you anything. There's your through pass. You have to score with it now. For the session, I think just for, I know there may be more questions. Maybe can we get maybe an email address for Prof that we can email all the questions to whoever might have outstanding questions? Will that be fine with you, Prof?
Yeah, that's fine. I'm putting it in the chat at the moment.
Thank you so much. While the Prof is uploading his email address, I'm going to allow our alumni, Dr. Lindo Dlamini, who is doing his community service in Pietermaritzburg, to render to us a vote of thanks. Over to you, Dr. Lindo.
Thank you so much, Lamgelo. Greetings to the colleagues. I am Lindo Dlamini. I'm sorry you can't see me. I'm struggling to open the video. But anyway, I'm Dr. Lindo Dlamini. I'm currently doing my community service at Northdale Hospital in Pietermaritzburg. Thank you so much, Prof. That was very informative. We always want to specialize, but the how part of it is always a problem. So thank you so much for that. And I really appreciate these sessions that we always have, because they kind of furnish us with the details of how to go about getting what we want to get as far as our profession is concerned. So thank you so much for that. Personally, I've gained a lot from this mentorship program. I've been part of it since my first year of internship. And it has been quite a good and a great journey where I've met a lot of people in my profession, like a lot of doctors who have qualified, who have went through internship, been MOs, been registrars, and now they are consultants. So I've gained a lot because they've been through all the phases of the profession. So thank you so much for that. Thank you so much, Prof. Clover and Dr. Singaram, for organizing such a wonderful platform for us junior doctors to actually get more insight about our profession. Thank you so much, colleagues, for your time and for tuning in. I strongly believe that this session today kind of provided us with more insight, and it furnished us with all the details we need in acquiring what we want to achieve at the end of the day. Thank you so much for that. I'm just going to leave it at that because of time, Dr. Mkize. Thank you so much.
Thank you so much, Dr. Lindo. I'm going to give the Prof. Lover a chance to say bye to us. I see her hand is up.
Thank you so much, Lwamgelo. Thank you, Prof. Copeland. That was awesome, really amazing. Actually learned so much myself from your presentation. So I've got a few take-home messages. So yeah, thank you so much for your time and for preparing that talk that you gave with aplomb. So I just wanted to mention to our young colleagues here, as Vina also mentioned on the chats, if you are in KZN province and you wish to specialize in a particular discipline, please feel free to contact Vina or our chair. We will link you up with any of the specialists that we have at KZN. So when you are free or weekends, or you want to just, you're not sure whether you want to do anesthetics, or maybe you don't have anesthetics in your rotation and you want to maybe neurosurgery, please let us know. We will link you up with the head of department and you can go and observe and spend some time there. Or for that matter, even if you want to do research, any project whilst you are an intern or concept, please link with myself and Vina and Dr. Kimesh Naidu. We will link you up. All HODs are very keen to mentor you and guide you. Thank you so much. That's what I wanted to say.
Thank you so much, Prof. Always looking out for us, and we appreciate that. Prof. Copeland, thank you so much for such a presentation. To all our speakers today, to all our audience, to all our first-time participants, we thank you for spending time with us. We hope to see you in our next session. Please be on the lookout for the new invitation for our next session. Yes, it's been a good session. And thank you so much. Bye, everyone.
Hayi, siyabonga bhuti, siyabonga mfowethu.
Thank you.
Thanks, Ramkelo and the committee. Well done.
Well done, Namkelo and Kapil and the committee. Great program.
Absolutely. Great chairs.